Hello, welcome to the second part of our lower limb podcast. My name is Maz Alsaffar, and as ever, we're going to start by separating the anatomy into different compartments. So let's start with the anterior compartment. Let's start with the tibialis anterior. So the proximal attachment is the lateral tibial condyle, and the distal attachment is the first cuneiform bone, or also known as the medial cuneiform bone, and it also has an attachment to the first metatarsal. Its innervation is the deep peroneal nerve, and its function or action is to dorsiflex the foot as well as assisting in inversion of the foot. Now, the best way to differentiate between dorsiflexion and plantar flexion is to imagine that when you're doing plantar flexion, that you're pressing on a plant, i.e. plantar flexion. That's the best way I remembered it. Extensor digitorum longus. Again, the proximal attachment is the lateral tibial condyle, and its distal attachment, if you can tell by the name, is the middle and distal phalanges of toes 2 to 5, so the lateral foretoes. Its innervation is the deep peroneal nerve, and its function or action is to extend the toes as well as dorsiflexion. So the extensor hallucis longus proximal attachment is the anterior surface of the fibula, and its distal attachment is the distal phalanx of the great toe. Again, its innervation is the deep peroneal nerve, and its function or action is to extend the great toe, which you can tell by the name. Just going to have a closer look of the muscle itself, because it's quite hard to see it from the diagram. You could tell where the proximal attachment around the fibula is from this diagram. Take a closer look here, you can see clearly the path it takes towards the great toe. Peroneus terratus. Its proximal attachment is the distal aspect of the fibula. Its distal attachment is the base of the fifth metatarsal, and again it's innervated by the deep peroneal nerve, and its function or action is to dorsiflex and evert the foot. Now let's move on to the lateral compartment. Peroneus longus. The proximal attachment is the proximal surface of the fibula, which you can see clearly on this diagram with the arrow, and the distal attachment is the first metatarsal and cuneiform bone. This muscle is innervated by the superficial peroneal nerve, and its function or action is plantar flexion of the foot, as well as assisting in eversion. Peroneus brevis, which is just below the longus muscle, its origin is the distal or lateral surface of the fibula, and its insertion is into the base of the fifth metatarsal. Again, it's innervated by the superficial peroneal nerve, and its function or action is plantar flexion, and again it helps in eversion of the foot. This is just to show you the Peroneus brevis. Okay, so now we've gone over the anterior and lateral compartment. Let's take a closer look at the posterior compartment. What I'm going to do is I'm going to show you the images of each of the muscles in the posterior compartment, and then I'd like you to identify the proximal and distal attachments, the innervation, and the function or action of each muscle in your own time. The first muscle I'd like to talk about is the soleus. Now the soleus muscle is quite a big muscle. It sits behind the gastrocnemius muscle, which is shown here in the diagram. Now you can see that there are two heads to the gastrocnemius muscle. That's the medial head and lateral head. There's also the plantaris muscle. Now together with the gastrocnemius and soleus muscles, these are known as the superficial muscles of the posterior compartment of the leg. Again, just try and identify the attachments and the innervation and the function, and this will allow you to memorize it. The next muscle is the popliteus muscle. It wraps around the posterior aspect of the knee joint, and as you know, there are some important vessels around that area. Flexure digitorum longus. So we've gone over the extensor digitorum longus muscle. The flexor digitorum longus muscle is quite a big muscle at the back, and you can tell from the name what its function really is. Flexor hallucis longus, again we've gone over the extensor hallucis longus muscle. Now I want you to identify the attachments as well as the innervation and function of this muscle. And finally, the tibialis posterior. So we'd like to make things simple when we're learning anatomy. So the take-home message from this podcast is: the anterior compartment is innervated by the deep peroneal nerve, the posterior compartment is innervated by the tibial nerve, and the lateral compartment is innervated by the superficial peroneal nerve. So thank you for listening to this podcast. Join us next time for muscles of the back.